We're both integrative medicine physicians, MDs. We have a practice in Cincinnati, and we grew up originally in South Africa.
We have a wonderful 30-year-old daughter who was diagnosed with stage 4 ovarian cancer at the age of 29. She works for Google in the YouTube division and was working abroad and came back to America and was living in Los Angeles, working exceptionally hard, and had some very vague, non-specific symptoms that she'd seen her primary care physician for and that we all attributed to her work conditions and the stress she was under. And when she was diagnosed, it was obviously a very, very devastating diagnosis for our entire family. Her older sister is also a physician, and between Steve and I and our other daughter, we realized that her prognosis was pretty bad, and that right from the onset, we realized that we really needed to go beyond the current standard of care for the treatment of ovarian cancer. Soteria has been absolutely fabulous for us because of the work that we do in integrative medicine. We really look at the entire patient, and we understand that standard of care for cancers are phenomenal. There's some cancers right now that are doing incredibly well, and a large part of this has been because of the development in immunotherapy and the treatment of cancer changing to being more gene specific for the actual tumor, and not just because it's ovarian cancer or lung cancer. Ultimately, cancers are going to be looked at very differently to the way we currently treat them with chemotherapy. And in patients who have unfortunate cancers, as our daughter has, where the prognosis isn't great because of the standard of care that we currently have, we were so fortunate to find Soteria because they helped us to take genetic material from her tumor and helped us to research different options that would be helpful and adjuvant to the care that she was getting with the standard of care for ovarian cancer. Our daughter has been very, very fortunate in that she's currently enrolled into a vaccine trial that is hopefully going to make her own body recognize her own tumor cells and awaken her immune system in a way that no other therapy that she's had so far has been able to do. And we are very hopeful and fortunate to be in this position. And Soteria enabled us to do this. So Soteria helped us bridge this gap between the traditional treating oncologists and people who are doing research and on the cutting edge of all these new immunotherapies and different approaches to cancer. We couldn't have done this without Soteria, and Soteria needs help. They need support because there's no other organization that fills this void to create this bridge between the patient who's in the center, the treating oncologists, and the researchers. I can't say enough about the help that we've had and how wonderful it's been to have this support.
We know that the same old treatment will give you the same old results. Soteria helped us do this because through their guidance, they were able to do a lot more genomic testing. And with that genomic testing, they gave us specific advice that we feel that has been very helpful in changing her prognosis and altering the course of her illness. This is going to be the new kind of medicine. We need to look at each person and understand what they need specifically, and then apply that specific or precise treatment for them. Each person that gets the correct treatment will do much better than the standard of care. Soteria has really helped us by giving us not only expert support, second opinions, but they've really helped collate this enormous amount of data that's out there and make it more personable or more user-friendly for us. And as physicians, it's hard enough, but as someone who doesn't understand this field, it is completely overwhelming. So Soteria is able to crystallize this data and make it usable. And we feel this is going to absolutely change medicine. It's the idea of taking one person at a time and personalizing the treatment to them is the new frontier of medicine. And this is really what we all need to push. And it's not about helping one person. Donations to Soteria are not just going to help one person at a time, but really to help change the field, to change the standard of care. So we have a new way of looking at people. And this is really what we need
And the model that Soteria has is scalable and applicable to a large number of patients, and particularly patients who do not have access to this kind of extra help, and it should be available to anybody. We were fortunate in that we had the right connections and we had people who helped us to get to the stage, but really, if Soteria had enough money and funding, they would be able to scale this model and make it accessible and easy to use and much more available for everybody who needs it. To me, Soteria provides hope.
And to me, Soteria means help.